break down products of ketamine and pass through your bladder. So 90% of that comes through your bladder, and that causes it's basically toxic to the lining of that bladder. The lining becomes thinner, so your bladder is basically like a muscular balloon, and it needs to retain its muscular integrity in order to store that urine. But what ends up happening is you damage the lining of the bladder, so you get pain when you pass urine, you get blood when you pass urine, you get increased frequency, so you're going to the toilet more often, and you get people who are in their early 20s wetting themselves because they've taken so much ketamine, and they've basically destroyed their bladder, and then they need to have surgical procedures to restore their bladder if that's possible. And if that's not possible, then they need to have a bag on the outside of their body to store the bladder.